Good evening, everyone. I hope all of you are safe and healthy at your place. And it gives great pleasure today in this great evening, and it's night in India maybe, to have Elisa with us to give a talk on Watsu in aquatic rehabilitation. And Elisa has been doing a lot of work in water, and let me briefly introduce her to you all. She is primarily a physiotherapist, but she's done her MSc in Pediatrics, and she is a professor at CU San Pablo University. She is a founder of Watsupath Training Institute in Spain, and she's been a concept creator for craniosacral therapy in water. That's right, Elisa? Craniosacral therapy, CST? Yeah, that's great. And maybe at some point in future, we may have some talk on CST as well.
Super.
Yeah, so, and she's also clinical Watsu 3 free flow instructor in training, and also an IC instructor. She's also vice chair of ESAC, which is Education Standards Advisory Committee at the Worldwide Bodywork Association, that's WABA. So it's really a great pleasure and to have her with us to this wonderful topic. And I believe that Watsu has been there in India for a long time, and from past couple of years, not couple of years, I think from past decade, the physiotherapists have been exploring this concept to bring it into clinical work. And so we have been looking at its application in the clinical arena. Let's see how we will be able to make the justification of Watsu to apply to our clinical patients, and let's see how this goes. So we have Elisa for you. Elisa, it's you.
Thank you very much. I hope you hear me well.
Yes, yes.
So thank you so much for the presentation and for inviting me. If I wasn't being in India, I wouldn't be here. So thank you, Aquatic Therapy Network, and thank you, India. I'll be sharing the history of why I started Watsu so that you will understand why I'm saying this. So shall I start sharing the screen?
Yep.
Okay.
And Lynn, can you mute all the participants?
Yes, it's done.
Okay.
I think you can already see the screen, or it's coming at least. So, do you see me? Well, not me, but my screen. I hope so. Well,
yes.
So, thanks. As I was saying, thank you very much, Prashanth, for inviting me. And we are here to celebrate the World Watsu week. So this is our week, right? And so I took the license to share the logos also for WABA and Watsupath. And so at the very beginning, when Prashanth asked me to speak, I was very clear. I wanted to bring this topic, Watsu in aquatic rehabilitation, because it's a hot topic. So my intention for this presentation, apart from celebrating this Watsu week, is to share the colors that I use to paint my clinical practice. And I would like to hear, when we have time for the questions and answers, that you also share with me what are the colors that you bring to your practice. And well, for those that you don't know much about Watsu in clinical arena, maybe things will change slightly after you hear this. Let's see. You'll tell me. So first thing I would like to start with is asking you, what is Watsu for you, and what do you know about it? Because this is a way I start my sessions or the basic Watsu classes, because it might happen that patients or students, they've only seen YouTube video or some pictures, or they have read a little bit, or they have experienced Watsu by receiving a session, but what is it who was the practitioner that was giving you, was it a certified practitioner or not, and that will condition for sure the experience and also how we will also work with them. And so what are the colors also for you and for those potential receivers? In a personal aspect, I wanted to share a video that was recently created, but just to share the experience that I had with Watsu. I got to know Watsu by chance, and I had a car accident, and I decided I was gonna study something that I received 5 years before. So I went to India, and I was planning to attend a class in Watsu Goa, and I had another accident. I had a holy cow crossing my way, so I had to stay there for 3 months, and I had the luck to be invited by Roger White, the owner of Watsu Goa, to stay at their house, and so I spent a long time in the water every day. So yeah, definitely there are some principles in Watsu that made very special to me. It was a very big change in personal and professional aspects, and it really changed me. There is these principles, the alignment, the adaptation, and the engagement that we have in Watsu, that they really break my foundations of my clinical practice. And of course, the fact that we apply the principles of immersion and the properties of water, allowing the water to do the work, so that practitioner becomes invisible. And that wasn't really matching at the beginning my big ego, which was part of the process and the beauty that I find every day. So how the attention of the receiver goes inside and creates permanent changes with this unconditional support that we provide in Watsu, and allowing them to surrender to the water. For me, in my path, there were other tools, as Prashanth was sharing, that came like IT or healing dance that you're seeing in the images, and of course Halliwick, and they are all part of my clinical practice, and they match together in terms of what is the best for the patient in each single moment, and that's part of the things that we are sharing now. But definitely what the patients share is that they experience their bodies in a different way after the session, and they are allowed to express and to be in a way that they haven't experienced before. So this space that Harold Dahl, the creator of Watsu, brought to us is also what I'm gonna honor during this presentation with you together. So this is the beauty of Watsu, also bringing all of us and discussing how we can bring Watsu also together to a different level. So that's something that I hope, if you haven't experienced yet, you get the experience too. And because there's only one first Watsu in your life, and so when it happens, you can feel lucky. All right, so what is Watsu? The definition that we've been reading for a long time, it's that it's a passive form of aquatic therapy or aquatic bodywork. And I was very glad to read very recently a definition that was delivered by the Educational Standards Advisory Committee from WABA, defining Watsu as a form of aquatic bodywork characterized by one-on-one sessions in which the practitioner is holding the receiver in warm water with nose and mouth above water, which also differentiates Watsu from other disciplines that are where we work underwater. The aim of Watsu is relaxation and recreation and personal growth, and therapy, finally, included in the definition, right? So I think, or I believe, and this was shared with me, with Harold on the time shared together. I don't think he was aware of the impact that Watsu would create in thousands of lives worldwide, and also how Watsu would develop over the years with the contribution of many practitioners around the world. And so I think that's also something that we need to thank him, because he was able to give the space for us to contribute and to create other things, sisters of Watsu or adaptations of Watsu, like what we are talking about today. He was asked very soon to teach Watsu out of the States, and so he also created this registry where students and instructors and practitioners authorized to teach and provide Watsu were registered, right? And later training institutes were created so that we could be a link between students and the Worldwide Aquatic Bodywork Association, where we have a board. And I want to also say, congratulations to Prashanth here in public, where we all are sharing, because he's part of the board now. And I'm very happy that someone like him is helping us to create a change. And so besides that, we have the ESAC committee, the Educational Standards Advisory Committee, different committees for ethics and promotion, trademark, and of course, scientific and research. So the first objective that I wanted to bring to the presentation was to break some misconceptions. So the first of all, how we can understand Watsu as a specific aquatic therapy method today. If I go to Wikipedia, I can read Watsu is a form of aquatic bodywork used for deep relaxation and passive aquatic therapy. So should I believe Wikipedia? Well, I'm not sure, right? And so I go to another source and I find this beautiful paper published by Agnes Schitter. She's delivered few papers, but this is the strongest one. Systematic review and meta-analysis, where we actually can read in the title passive. And I think that we have been kind of forced to fit in a box. And so actually, if you read the paper, you will see that it's not conceived like that. And the aim of this research was to actually find out more about how we can apply Watsu in a therapeutic way. What are the benefits? What are the applications and the indications of Watsu as a therapy? And we'll talk about that later. She also delivered another one where it's also mentioned passive, but actually if you read one of the conclusions is that Watsu mobilization can enhance body awareness. So I'm gonna pull this conclusion to share my hypothesis, right? How interoception, exteroception, and proprioception make Watsu a definitely active aquatic therapy method. I'm glad to read very recently from Turkey, another instructor has just published the effects of Watsu as therapy, right? Mentioned as therapy in the quality of life and gross motor for children with cerebral palsy, which I encourage you to read. So what are the benefits that Watsu have, or what do we know from a long time ago through clinical practice and some of the papers that have been published? This that is benefiting most of the orthopedic impairments and most of the neurological impairments that we will be speaking in detail a little bit more about how to adapt. And many types of like respiratory disorders or fibromyalgia, post-mastectomy, or as a complementary as treatment in stress or insomnia or depression with weaker or stronger evidence, but definitely clinical evidence. All right, so trying to reinforce this hypothesis that I have, I go to a recent definition of neuroplasticity, which is recent, but it's more or less what we know, right? It's the ability of human brains to reorganize themselves continuously during our lifespan. and it's not only dependent of the genetic information, but the changes of the environment. So how we interact with the environment, that will also modify our brain and our perception of the environment. Then I want to go to definition of movement learning that is not so recent, but is talking about a group of processes associated with practice or experience that leads to permanent changes on the capacity we have to perform functional abilities. So that means that if I'm floating someone in the water and is experiencing movement, this movement is creating also a permanent change in the capacity that this person has to perform this activity, right? That's part of what I was thinking since years ago, right? And we've been using proprioceptive stimulation techniques for many years to increase postural tone or to change postural control and movement against gravity. So definitely, if our patients are being held in water, having the experience with the interoception and proprioception and exteroception information that they are integrating in their central and peripheral nervous system, then we might think that is a reality that we have motor learning. Well, I expect that we can prove that one day, not very late, sooner than later. Oops, sorry. So in order to achieve and to embody all these principles of Watsu, what is the appropriate attitude that as therapists we might have? Well, you might hear this in all Watsu trainings, right? The receivers or the patients, they come for help, they come for support, and they will actually, their bodies will guide the process. And it's our job to help them to become independent and autonomous and encourage them to take responsibility of their own process. So in order to achieve that, I believe real listening and presence are qualities that need to be there. So listening is not the same as hearing. Yes, listening requires hearing, but it also requires attention and understanding. And sometimes we find ourselves engaged in certain obstacles like, well, we might be tired or overworked, or we are working in an environment that is too noisy or too cold or too hot, or we have a busy mind judging or comparing or filtrating or identifying. And so how can we really be listening to what they have to say, being present, being in the moment, and encouraging them to speak and to be with, so being with them, it's also allowing them to be. I'm not saying that all our skills and all our background and our knowledge won't be in the process, but to keep that on a side so that we are really in the moment, being aware of the different layers that we can allow them to unfold, and so that we actually are mirroring them and giving the space with this caring and the attitude of service that we all as therapists we have for sure. But yes, reminding us to give a space us to be and not to do. And this was also one of the things that I said it was a breakdown for me. Actually, it's not all about doing, and it's more about being. So the second aspect that I wanted to bring was to understand fascia as a system. So when Harold was talking about free flow and follow movement, what was he talking about? Or what is it that we find in our clinical practice? Well, there are dozens of papers right now that can support the fact that the body is a unity. Fascia is surrounding, connecting, it's enveloping, communicating, protecting everything in the body from the superficial to the deep level, from proximal to distal and from cranial to caudal. There is this beautiful work that Jean-Claude Guimberteau has developed, and I encourage you to find its beautiful work of images where we can really see how the fascia behaves. And so these components, these rigid components that are connected by tensile components that allow us, or allows our, they are allowing our body to really be in a dynamic equilibrium, and so that when we interact with the environment, or we interact with the different aspects that are happening in our body, we can still be healthy. We actually know that in order to have a healthy body, we need to have a healthy connective tissue. It has the greatest importance within the immune system, the lymphatic system, the nervous system. There's so many information that the fascia is carrying. And so this tensoritive structure that we have, it's not only on the macroscopic point of view, but also on the microscopic. And fascia is very irrigated and innervated, and is carrying pain information. There was recent studies, amazing recent studies are providing us very important tools for us to change the paradigm, right? But actually, Peggy Schrödinger, who you might know, she's a PT and senior Watsu instructor. Years ago, she was sharing this in a book. Patient with a stroke with hypertonicity may have limited mobility that is caused by the damage on his central nervous system. This immobility would cause a loss of elasticity and myofascial restrictions that will affect motor control. So we know that Watsu influences both neuromuscular and musculoskeletal system. This will allow our patients to experience movement with less pain and greater freedom of range of motion. I found this paper some time ago where pain is understood or farther from this biopsychosocial model as an inactive process, where definitely the individuals, we are in relationship with the environment, and there is a reciprocal, very strong and profound relationship that affect in both ways. So, and as both therapists or body workers of different specialties, we have experienced, most of us, that working on someone else and giving a mechanical input, there are not only physical releases, but also releases in many other aspects, and even memories coming or different aspects that are related with the blockages that are unfolding. So it's actually very important that we open our beings and our minds to really take care of the bodies we're holding as beings. So how can we provide the safety and taking care of some precautions and in different conditions that we will go one by one. So we have these 5 steps, evidence practice, that I'm sure you know. And so with our first plan, right, and we have the support of the evidence, how can we validate that, and how can that make to contribute in our clinical decisions so that we can also change, if it's necessary, adapting to the needs of our patient. I truly believe, and I'm sure you agree with me, that one of the strongest keys in Watsu is the triangle of head support. This was a big contribution from Mario Yahara, and I think it's really, really important. It makes a Watsu 5 stars Watsu, and of course, depending on who we are holding, we will need to adapt, but also we will need to adapt the head support on every single moment of the session. So this triangle is created between the hook of our elbow, a little bit above the protuberance of the occiput, our armpit on the near shoulder, and the heel of the hand on the far shoulder. it needs to be a free support. So we are allowing the movement, right? We are allowing our patients to breathe and to move in our head support, but also we need to take to bring the awareness always to have constant traction and alignment and creating space in the whole spine, avoiding the hyperextension of the neck. And as I said, adapting constantly to the needs of the patient in every single moment, which is sometimes a challenge when we have patients like those with very sensitive, they are very sensitive to vestibular stimulation. So in that case, we need to move a little bit slower, and very important to keep both ears underwater constantly, avoiding turbulence and excessive noise. And also, you're gonna hear me a few times later also how important it is to create a link and communication with our patient so that we actually can provide the best support for them in every moment. With this alignment, still the rotation is allowed, but very important to have alignment also between the cervical spine and thoracic and lumbar spine. Sometimes earplugs can be used, and also keeping the body underwater is important for their comfort. So another key point or cornerstone is the lumbar spine, to have the support underneath the sacrum and sometimes closer to the trochanter's. So we are close to the flotation point. And that's why floats were created in Watsu. It's very important to keep the legs negative, so they are not out of the water, but below the water, so that the body behaves in the most natural way without a hyperextension on the lumbar spine, but the way we apply also the support and letting the water but being there for them, and also with the help of the floats, which is a great tool for us, right, to work. And it's also an art, I think, to use them properly. And it's our responsibility as instructors to really teach students how to use them properly. These ones that you see on the pictures are made by Watsu Czech. Very nice people working here in Europe for the best. And so we have different colors, different sizes. Colors and sizes go together, right? The green one you see is an extra large. And then blue is L and yellow is M, and the red is the small one. And so if we want to keep the legs negative and we have a very sinky pelvis, then we might not want to place the floats on the calf, but on the thighs. So the closest we have them to the pelvis, the higher the pelvis will be, right? And so we can keep the alignment of the lumbar region, avoiding hyperextension. But I said it is an art, because if we overfloat our patients, the knees or the feet will be out of the water, and that's also creating discomfort and compression on the spine. So for those situations where our patients are in acute pain or severe pain, also being slower on the activity and the movements to avoid turbulence, and being very attentive to the signs that we see in their faces. I know we do this in every practice, right? But the fact that we have learned that we don't speak in Watsu, I think it's important also to create a code with them, and so that they are also able to express what are their limits and express whatever they need, to have this open channel of communication during the session. I believe it's very important. And we have this book, Aquatic Therapy. It's only written in Spanish, but this phrase is coming from this book, and and I think it's very nice. It's when we have good planning and good tools, and we are trained. We have an excellent training as practitioners. These may have may make it possible to take care of clinically fragile patients. It doesn't mean that it's they go together, right? But we can hold people with some absolutes sometimes and relative contraindications when we know how to do that. So let's move to orthopedic conditions. I wanted to pick some examples, and of course we open the space after for questions. Well, I have a strong experience working with whiplash and temporomandibular joint disorders in patients, and what we aim to give comfort and stability, to reduce pain and to increase range of motion. Sometimes the vestibular system is also affected, right, because it's very linked, and many times they have orofacial pain or migraines or headaches. So we want to reduce that pain, and of course we want to emphasize the trunk elongation and sometimes work on the points, specific points, right? And so the head support needs to be accurate and very specific, avoiding any hyperextension, keeping the alignment especially on them, so that we prevent any pain when they go out of the water. And so for these patients, the vestibular stimulation, so keeping ears underwater and doing slow movements, at least as soon as we understand how they behave in water and how they move and what are their limits. They would also benefit of working on all the foundations in the body, which I understand are the ankles, the pelvic and the shoulder girdle, the hyoid, diaphragm, the occlusion, so sometimes working on the points that we know from shiatsu in the face and the neck, and so global work, right? Not only locally, but also working globally. And for those other cases that you see on the screen, the stenosis, these disorders like herniated disc or any other degenerative joint disease, we want to decrease pain and to maintain spinal elongation, flexibility also as they tolerate. And we might work on the back, specifically on the back series that we know from Watsu, and sometimes we work with collars, so we can choose which stretch is appropriate for their tolerance. And again, we want to emphasize stabilization with them. If we move to neurological conditions, Parkinson's disease, of course, we want to gain also in trunk rotation and decrease tremors and rigidity. And we find, of course, that posture awareness is very important in these patients. So we might also want to emphasize the trunk rotation and the elongation, and very gently increase the thoracic extension on them. So moves like spiral offering or rotating accordion, or simple moves like near or far leg rotation, or working on the spine very gently. They might get a lot of benefits on working on the chest, chest opening. And I don't know if you've read of the link. They also suffer many times from allergies and intolerances, and so working on the hara and also on the diaphragm would be very important. In cerebral palsy, we could speak a lot, right? And we need to differentiate also the type of patient we have, if it's spasticity that they have, or it's an ataxic or attitoid, or or they have hypotonia on the axis, so the head support will be different, right? And so sometimes I found, or you might have also, with patients with hypotonia, working with the head on the shoulder, so giving gravity and also the pace that we use and the rhythm that we use will increase their tone. When we have someone with spasticity in our arms, the speed needs to be very much addressed. We have to be very careful not to trigger spasticity or involuntary movements. We want to work on the trunk and, of course, on the range of motion on the lower limbs and relax or normalize the tone and normalize the parasympathetic nervous system. So helping them maintaining flexion of the neck or slight flexion of the neck and hips and knees above the water, sometimes with noodles or with the floats, and emphasizing these repetitive movements and gentle movements, working on the limbs with the two-leg offering or the spinal offering, or rotating accordion, the swings, the saddles, right? The saddles sometimes, as you see on the picture, so giving some support on the pelvis, also giving information to the core and the stability of the pelvic girdle and the trunk. It's also very important, I think, to use the water to increase the movement. So it's not so much about us mobilizing them, but letting the water, and so they also can enjoy the sensation of movement. In relationship with the head support, I also wanted to say for brain injury and stroke, but also cerebral palsy, it might not be a triangle, right? And we might have only 2 points because sometimes it's not possible to have the arm behind our back. So I find also holding the scapula will also prevent us to trigger the extensor push, and sometimes it's possible to work with pillows, not with all of them, but also, sorry, this will bring also the possibility to work on the extremities in a different way. For multiple sclerosis, what I wanted to mention is the importance of keeping the length of the session would be adapted to each case, and also the tolerance they have for the temperature. And in terms of cervical dystonia, I wanted to show this paper. It was developed by authors here in Spain, the use of Watsu in cervical dystonia. They found that depression was decreased, but not so much anxiety. And my personal experience is that, yes, that's true. But the movements are not decreased. So these sporadic movements that they have, they were not decreased in many cases. Right, so there's so much research related with fibromyalgia and Watsu, some also with myofascial pain syndrome. I think here it's also important to bear in mind the length of the session, the dosification of the session when we work on the points and the range of movement and the lengthening of the spine. It's helping them a lot, but they might not feel it's too much when they are in the water, but later on. And so that if we're doing too much, that might prevent them to be able to go back in a regular basis. So yes, of course, they will benefit from working with us, working on them, and not only with Watsu, but with other tools, of course, and so that they also learn to dosify themselves with their activity. But the experience that they have, the relief of pain and the quality of sleep and the quality of life that they experience from the very first session, that helps a lot with the fear of movement also. Well, a special mention to cancer patients. Well, my experience was years ago with post-mastectomy patients for a long time, and some survivors, children survivors with some consequences. And lately lymphoma patients. Very interesting how to treat them during their treatment, oncological treatment, and so being very aware of the hematological levels they have, taking much care about the fragility of the skin. So talking every day with them, every day before they were coming to the pool to find out how they were feeling, how was the immune system at this very present moment, and keeping a very strong communication also with the oncologist. But this was allowing them to really experience the quality of life, the experience of their bodies being alive. That was very powerful. And also very recently, I'm sure, because I saw Caroline Barmatz was joining us, and she was working during the lockdown very much. I started working in May, the end of May, beginning of June, and the fact that most of the patients that I was welcoming were nurses and doctors and psychologists working in hospitals during the lockdown, and being able to hold them was really a gift. And so their feedback and being able to witness how they were letting go things that they were really a big weight in their backs and hearts. So I hope you, when you go back to the water, you also have the chance to do that, because it's very rewarding. Well, very briefly, of course, when we work with children and adults, I would say elderly people, I think it's my experience is that it's more important to be very interactive and speak, and this communication is even more important. So we sing and we interact during the session. So when we speak to students and they ask about the application in pediatrics, of course, a session with a kid or with an elderly, it would be different. We need to be constantly communicating, and the experience that they have maybe at the beginning of the session, because we normalize the tone or we allow the movement to happen, that it wasn't happening like that before, that will encourage them to move in the pool, right, to walk or to move with different exercises. And almost finishing, just how to embody a qualitative approach, bringing again this communication with patients and reinforcing or highlighting this less is more. I really wanted, a few years ago, I really wanted to prove the efficacy and efficiency of Watsu in children with cerebral palsy. And it came out that I wasn't interested so much in the quantitative aspects, right, the function or the structures, but I was more interested in participation. How was this affecting, what were the experiences that they were having when receiving treatment in water? They were actually receiving Watsu and craniosacral therapy in water and Halliwick for ethical reasons, but what we found out very briefly is that we were carrying participant observations, so they were observed in the school in different environments, and how they were connecting with the environment and interacting. It was very beautiful. You can read these results. I didn't bring it all, of course. I'm sorry. And also how movement and posture was changing, and the learning process for them was also affected. This was also pointed out by the practitioners working with them, that were perceiving this therapy as beneficial, and that it was possible to transfer, and that it was also affecting the participation as well as the structures and functions. This was also shared with the parents were also asked, and the results were also similar, as well as for the children. And it was very beautiful to see how it was very significant for them. They really wanted to be in the water. They felt that it was improving their quality of life. They were able to play more, and they were feeling safe there. They weren't perceiving barriers or on the application. So I think I'm running out of time, so that's why I'm rushing a little bit. Just to close, I wanted to mention Cameron West and Peggy Schrodinger again, because they were the ones, I think, correct me if I'm wrong later, breaking the wall and bringing clinical Watsu to the scenario and creating the core curriculum that we have for clinical Watsu 3 free flow right now. So I hope many more of us will be in the clinical arena. And going back to research, I wanted to say that you have available in our website, you will find the links and be able to download many papers that we've been collecting. And I wanted to go back to the first paper we saw from Agnes Schitter, because she was gathering a lot of information how acute and chronic conditions were benefiting from Watsu, not only in pain, but also in physical function and mental issues. Another conclusion was that the grade of evidence was estimated to be low or moderate. So I'd like to encourage all of us, starting with me, to create high quality randomized control trials. So we really bring Watsu to a different level. And invite you to the pool where I work and teach, the Fundación Instituto San José in Madrid. I hope we one day we're able to meet in person. I know we're many of us here, and that's amazing. But you know that you are welcome. It's a big pool, and I hope we can share together. So thank you very much. I'm gonna stop sharing the screen.
Thank you.
Thank you.
Thank you. That was a very interesting presentation, and I think it opens up a big scope for all of us to think of applying Watsu from a clinical perspective. So, any of you have any questions? Please raise a bar here on the top. You see a small emoji icon with a hand. You can raise that, and then there is a show conversation. Please put your question there, and we will be able to see, and we will be able to put those questions and see how we can answer them. All right. So, Elisa, I had myself a question. Is it good to go?
Yeah.
All right. So I'm just wondering to see if we can, what kind of outcome measures do you think is more relevant to capture the changes that Watsu can actually bring? I think there were quite a few things that we spoke about. There was pain, and there was changes that are emotional. And there were changes that are physical. That would mean changes in the fascia structure or changes in the range of motion and things like that. So in your experience, what do you think is more relevant as an outcome measure for us?
But you mean the tools or the
the tools like WAS, visual analog scale, or you recommend something wherein we give a session before and after and we are able to capture the change?
Yeah, well, my the assessment that I provide is also including the visual analog scale. Range of motion, I have to say, I don't always bring the tools to the pool to measure. So that's why I was saying myself, the first, I need to perform good research. But yeah, definitely, I think for each kind of patient, we have different tools. If we work with kids, we might see the change that they have on the muscle tone and the ability they have when we perform a test like pull to sit, right? And it might not be the best to measure that after the session because they're much more relaxed, right? So I would do that at the beginning of the next session. And for Parkinson, I think we hold a lot of things in the water and it's very complex, right? But I always keep this time before the session and after the session. And 2 days after the session, I ask the patient to write me or to call me, and so we can speak about the changes. When they go out of the water, I ask them to walk, so they integrate the changes that they have happened during the session. And for me, it doesn't make sense to measure right after, because I know the changes will keep integrating in the body. So I would at least wait for 2 days to measure that. Or if I don't see this patient every day, and I see weekly or every 2 weeks, so I will measure that range of motion or any test like Berg scale or time up and go, or the scale that we use if it's a Parkinson patient, not immediately after the session. That's my opinion. I'm not sure if it's the one, right? But I think right after the session is the body is still integrating, and actually what we see is they're trying to find the posture, and they don't even know where they have the limbs, right? If we do 1 hour session, Watsu session, right? Or and also I find if we work with different tools, and that's also something that happened with the research I delivered. How to know if we are working with different tools in the water, right, in a daily life practice, what results are coming from what? If it's coming from Hollywood, coming from IT, coming from Watsu, or all of it together.
Yes, yes.
Which is what happens in most of the cases, that we combine different things, right?
True. I agree with you. That's quite interesting. But as a clinician, we are so much focused to see the change in a session. So there is a large temptation to take an outcome measure before and after. But I like the idea and also the thought that there is still an integration of the changes that's happening, and taking an outcome measure after 2 days or a couple of days, you actually would be able to see the change. I think that's very true. This is what we experience even with the patients who receive the Watsu session. After the session, they say it's great, but they can comment about it only the next day. When they come for the next session, they feel the joint stiffness is reduced. They feel more flexible to move. They feel more easy to move. I think that's a good way to measure, at least giving some time for the change to be integrated. Thank you so much, Elisa.
Thank you.
Yeah. Anybody else has any questions, please?
There are some comments on the chat box.
Okay.
So Dr. Yojana Matkar is, thank you so much for a beautiful presentation. I have experienced that water being a good conducting medium of energy. It is very important for us to, as a therapist, to stay emotionally stable as it can be easily transferred to the client. And that's nice. And now there's a question from Inayatullah Niyamat. What is your clinical experience with children with autism spectrum disorders and Watsu?
Yeah. I forgot to speak about that. Well, I had few experiences, prolonged on time. Actually, I had a mom publishing a picture today. What I found is the sensitivity to closeness. I would say that was one very important thing that was common. The social aspects of Watsu, the proximity and the contact, was reducing their sensitivity to be out there, right? And the vestibular stimulation was also helping, because sometimes that's the way they rearrange. I don't know how to say this in English, but how to regulate themselves. And yeah, I think the bond that is created, that was giving them the space to go inside and to feel them free to be with others. So transferring that they experience in the water, that was transferred and it was the changes were seen on the speech and the body language, their capacity to urinate and defecate, which sometimes they have problems to do it frequently. So qualitative changes, right? But very important.
True. I also had another question. Did you come across any patients with hyperactivity and say that after giving a Watsu session, did it make change in them to be more calmer?
Yeah, I was thinking now when I was speaking about the autism. I had a very challenging case. It was I was trying to combine things, right? Touch was very difficult. So we were keeping distance and we were using tools. And yes, at the end of the sessions, he was calmer. There were some peaks, so we had to change from one thing to another to find out how was he feeling comfortable. So I had patients with hyperactivity associated to other disorders, but I was thinking about this case where I felt myself that I couldn't really help much, or I was expecting, and that was maybe my problem, probably. I was expecting too much. Yeah. I think the water, it's a good environment for that. So this was an extreme case, right? But we might hear other experiences from other practitioners here, but in general aspects, when there were disorders associated with hyperactivity, the experience was very good, because either the activity or the soothing of Watsu and the mobilizations was being very efficient. And I can trigger this other case where I wasn't very helpful.
Okay. I have one question in my mind, but I will wait for others to see if anything else is coming through.
Okay.
Hi, I'm Susan. Thank you so much, Elisa.
Hi, Susan. Thank you. Hi, nice
I do have a question. You know, I have a patient. She has MS, and her main physiotherapist was a bit afraid that we take out too much, too much tonus doing the Watsu. That should be almost like too limb afterward. What do you think?
Well, the water, I said water temperature is important, and my experience, or the experience we have in the pool, right, is not only mine, but the colleagues I work with. We combine Watsu with Halliwick and gates if they are able. So exercises that will actually work on the tone. So we want to increase range of motion and decrease spasticity if they are, or sensitivity. But we also want them to work on their axis or transfer or prevent them falling, or right. So not the entire session would be Watsu, in my experience.
As in ending it with something active to kind of.
Please don't say active.
Yeah.
I'm joking.
So that would be the end part?
It would depend on your patient if it's the best to start with Watsu or the opposite, right? Sometimes it helps when we start with Watsu to reduce the sensitivity and the pain and calm down the system so that they are ready to do exercise. And, and sometimes the opposite, or in the middle, right?
Okay, thanks, darling. Thanks.
Thank you.
I think that was quite. She asked almost the question that I was having in my mind, to say whether should we have only Watsu as a session, or should we mix a combination of things. So in my practice, I make a combination of stuff, as you said, is that mixing the tools. So I may use Watsu only for increasing the range of motion. Once I find there is a change, and then I may integrate that with other tools like water specific therapy or active exercises in the pool and other things, which can integrate the change that we brought in Watsu.
Yeah.
Would you agree with that?
I think there are opportunities for everything. I mean, there's no us. I don't have a system, right? But because I think sometimes the patient comes in a way that you know what is going to be the best, and you see how long this goes, you know, and maybe it's the end of the session you would do something else, but the way they feel or the way they come, even then they are not able to express, you can feel that that's going to be the most helpful that day. It doesn't mean that every day it's going to be like that, right? But I think we pulling this listening, right, and being with them, and also asking, so how do you feel and what do you want in every single session?
True, I agree with that.
Yeah.
Thank you so much. It was a great presentation. Lovely to discuss all the options that we have in aquatic therapy.
Thank you.
Is there anything else? Anybody's asked any other questions?
No more questions.
No questions.
Okay.
Is scary.
Is anybody asking a question? I see somebody trying to speak. Yeah, Carolyn.
Caroline
Yes.
is asking, but she is muted.
She's muted again.
Unmute all, Nalin. Can you unmute all?
Again.
Yeah.
Can you hear me?
Yes.
First of all, thank you. It was a wonderful presentation.
Thank you.
I think one of the problems that we have is that the health insurance, we have to be very careful not to say they're having Watsu, because then they expect them to do active exercises, and a lot of the land physiotherapists don't understand enough of everything you've just explained in this webinar, and things that people with experience in the water know, that basically we have the same outcomes. It's just a tool in our toolbox that we use to get these outcomes. So we sometimes have to be very careful. And if our land physios watch us floating somebody in the water or doing Watsu, they frown at it. They're not so happy.
That's why I think research is very important, because things have been changing lately. And I mean, I know in your pool and also in ours, Prashanth, and in Madrid, we combine things, and Watsu is very welcome and we use it. But it's true that when I started teaching Watsu at the university, it wasn't called Watsu. It was relaxation techniques and blah, blah. So yes, there's so many things to do yet, but we are on the path. I'm very happy. I mean, there's so many things that are changing, starting with Prashanth on the board, and I mean it's so many things that there are little things, and this being together talking about Watsu in aquatic rehabilitation. Which it wasn't happening before. I was crazy, I was hippie, and everybody was thinking that I was mad when I was starting doing this. But the facts speak by themselves, and so that's what we need to prove. And sometimes we might be wrong, right? And it's not that Watsu is for everyone, maybe, but we need to find that through research, and it's our responsibility to do that. Yeah. So for everybody here.
Yeah. I think there's somebody who's raised their arms. Agüita.
Thank you, Caroline.
There is one question, I believe. Somebody's trying to ask a question. Can you unmute yourself, Agüita? We don't hear you.
Yeah, we can't hear you.
Yes. Unmute yourself. Yep.
Yeesh.
We still don't hear you.
No.
Okay, so if you can write an email and send us the query, and we should be able to get back to you on that. I think the time that we had kept for 1 hour is up, and I really appreciate all the participants who joined us, and we are really glad we could make this. And I think this is the first of the series of webinars that we are planning to have, and there are more to come in, and with interesting topics that can help practically the therapists who are in the pool, to give them an idea and perspective to see how we can practice the different tools that we have to bring change in our patients. Thank you very much, Elisa, for being a part of this, and I believe you will still be a part of it. We will do a lot of other things in future together. Maybe we're just networking now, and we are doing a water connection. That's what I think we are doing now.
Super, that's great. Being
The
together.
water tribe.
Thank you very much.
Thank you all.
Thank
Really.
you.
Thank you.
Bye-bye.
Bye.
See you.
Love you, Lisa.